So whenever you have some sort of knee pain or any knee discomfort in general, one of the first things your physical therapist does is pay close attention to the strength of your hip muscles. For example, let's say when you're walking, running or jumping, your gluteus medius muscle, which is a part of your hip, controls the position of your knee. Even though knee pain can also be caused by many other factors like arthritis, repetitive stress or strain, or simply a trauma. But if you don't have such health issues, there are maximum chances that your hips are weak. If you look closely at the anatomy of hips, you will see that hip is a ball and socket joint, which means it has the ability to move in different directions easily. Also, it has many muscular or ligamentous attachments around it, because of which it becomes the strongest muscle group in your body. So when your gluteus medius muscle, which is a part of your hips, becomes weak, it makes your knee unstable and allows it to move inwards. And technically it is being called collapsing of kinetic chain. This abnormal position of your thigh can put excessive stress on your knee joint and your patella, that is your kneecap. इससे अच्छा है कि ऐसी नौबत आने से पहले ही हम अपने हिप्स मसल्स को स्ट्रॉन्ग बनाएं और सिंगल लेग मूवमेंट्स लाइक रिवर्स लंजेस, स्टेप अप्स या फिर वॉकिंग लंजेस को प्रायोरिटाइज करें. एंड लास्ट बट नॉट लीस्ट, रिमेंबर दैट इफ यू हैव just started developing some sort of knee pain or any knee discomfort, it just could be a sign that something needs to be corrected, and it's high time to seek out some professional help.